Our next speaker has a great topic, and if you remember me introducing Dr. Bowen this morning and said there were some emails and a phone call asking for favors, Dr. Lynn is on my list of people who I owe favors to. The world of alternative therapy is extremely important for all of us. How many people here have had an email, phone call, or note left for them about some herbal remedy that may ail their wounds or their problems? How many people here have tried an herbal remedy at one point or another? And so this is something that comes up constantly. It is the subject of a lot of discourse on the internet and in clinics, and there is a complete lack of very good, clear information or guides. And Dr. Lynn has accepted the challenge of giving us an overview of integrating alternative therapy. I'll start it off, though, with one anecdote, and we'll see what you think about this. I was, and some of the people in the room will know this, a patient of ours approached us after a recommendation was made to say, you have a neurologic disorder, you want to protect your neurons. That sounds good, right? So you should be taking neurotrophin, which is a substance, it's a natural substance. Neurotrophin in a dish will cause nerves to regrow. That sounds pretty good to me right now. And so the bottle was sent of neurotrophin. You can order it on the internet. And I said, well, let me just see the label. Neurotrophin comes from ground up pituitary glands of cows, ground up brain of cows, and ground up brain of pigs. And in the setting of mad cow disease in this world, it didn't seem like the best idea to me whatsoever. And it's my little anecdote of a buyer beware world. We don't always know what we're taking. And with that in mind, I'll let Dr. Lynn give us a survey of integrating these therapies. Thank you, Joanne.
Thank you very much. Let me get oriented here. So this is a difficult topic to speak on and somewhat treacherous, and so I have multiple disclosures. The first disclosure would be that I don't consider myself to be an expert on this. Most of these topics that I'll cover are not things that I've investigated myself, but I come to you as a person who practices in the neuroimmunology practice, the MS clinic at Ohio State, and I have recommended many of these things, and I know that the people that I see as patients use many of these treatments. The second disclosure would be that nothing I'm going to talk about is FDA approved. All right, so we're instructed to mention when we're going to talk about a drug that's not FDA approved. So let's just go into this. A little bit about definitions. So you'll see that the word used unconventional. Unconventional treatments are ones that are not widely taught in medical schools, although maybe we're getting a little better at that, or not widely available in hospitals. Complementary treatments are used in conjunction with conventional medicine. So I think of myself as someone that comes from a background of learning conventional medicine in an MD program. Alternative treatments are used instead of conventional medicine. So you see the difference between complementary and alternative. And then integrative is the newer word of combined use of conventional and unconventional medicine. And many hospitals and medical centers now have units of integrative medicine. We have one ourselves that's down the street from our MS center, and we refer some people over to there for consultation and ongoing advice about how to use some of these complementary approaches and integrate them in with the regular mainline treatment. How many people are using CAM, or complementary and alternative medicine? Well, there have been some large surveys. In a 2002 survey, 62% of people in the US said that they were using some form of complementary medicine. And the mind-body approaches, that's a large category, would be the most common types that were used. There was a smaller survey, more relevant to our topics today in a academic neurology center showed that 40 of 216 neurology clinic patients were using these approaches. This is old, these numbers are old, but they're from a survey of, and you can tell by the use of alternative medicine rather than complementary that it's old, but somebody tried to keep track of expenditures for alternative medicine from 1990 to 1997 and saw that people were paying out of their pocket, not often insurance reimbursed, 12 to 20 billion to alternative healthcare providers, and certainly I'm sure that's more now with a dip for the past couple years economy, but I'm sure it's more than 20 billion. So the deduction in that paper was that a lack of insurance coverage would not be a deterrent for utilization of alternative medicines. So what about in neurology in particular? Well, in the studies that have been done for multiple sclerosis, more than half of people with MS in the US are using some kind of complementary medicine, usually in combination with conventional medicine. Why? That's not hard to answer. We know that our treatments that we have thus far are inadequate in terms of stopping progression, cutting down attacks, the frequency of attacks as well as we would like, and certainly in terms of managing chronic symptoms such as fatigue and neuropathic pain. But the problem is that most neurologists, that may have been trained in a regular allopathic medical school, like myself, have limited knowledge about CAM and may not even think to ask about what treatments their patients are using. And some of these therapies are quite beneficial and are low risk, and we can all think of things such as acupuncture, cranberry, vitamin D, yoga. We'll go over some of these things. Others are just ineffective, dangerous, or unstudied, and we have various things that are promoted as immune stimulating or neurotropic supplements, and nobody knows what they're doing, and there could be rationales that they would be harmful. Bee venom therapy, hyperbaric oxygen, some are very expensive. I know people that have gone overseas to have various chelating treatments that are potentially dangerous. And some of these alternative therapies may interact with conventional MS treatments. So what are the most commonly used CAMs? So vitamins, minerals, herbal medicines, and we'll put cannabis in a special category. Acupuncture, there's magnetic field therapy, various forms of therapeutic touch, various forms of massage therapy, relaxation therapies with biofeedback, tai chi, and yoga, and then bee sting therapy are the ones that I see most commonly. So I wanted to go into a few areas in more detail. One area is the whole approach of traditional Chinese medicine. So this includes many different treatments, including acupuncture, diet and nutrition, various traditional Chinese herbs, as well as Asian proprietary medicines, exercise, tai chi, massage, and stress reduction. Unfortunately, there are limited studies with small numbers, and what English-speaking authors who have reviewed the literature say that none of these studies are rigorous. However, there are not many reports, or there's a whole vast body of literature in Asia in various languages that are not available in English or are only reported as very brief abstracts. And so we really don't know if there's a lot out there and need more of that to be translated. Acupuncture is a system of medicine based on the belief that disease results from disruptions of the free flow of energy. In health, there would be a free flow of energy or qi through 14 pathways or meridians throughout your body. And treatment is to try to restore these flows of energy. So that's acupuncture. There's also acupressure with finger pressure, shiatsu, cupping, or electroacupuncture as variants. The studies that have been done in MS are very limited. There was one larger study of 217 people with MS, and 2/3 of them reported various beneficial effects. So this was in 1999 in Neurology, which is, you know, a well thought of journal in our area. In some conditions, acupuncture has also been shown to alleviate pain and nausea and vomiting. So that, you know, that's a huge amount of treatment that many people seek out acupuncture, and there's really not a lot of good literature about it. Most commonly, my own group of patients are seeking relief from neuropathic pain. Some people not with MS, but with chronic headaches resort to acupuncture with benefit in some cases. And then some people hope to have relief from spasticity with acupuncture. Now, bee venom therapy is something that seemed to me like in my area, it peaked about 5 years ago and has come down a little bit in use. But this is a therapy that comes to MS and neuroimmunology from arthritis. So it was initially, there were proponents that the bee venom would be of benefit for inflammation and arthritis. What people do is to order a bunch of bees that come to them in boxes that have been refrigerated, so the bees are all calm because they're chilled. And then they keep them in the refrigerator and reach in with the pliers and pull one out. And usually most of the people that have shared with me about this are putting all sorts of shots on their putting the bees on their bellies until they can get them to sting. And trying to get a cumulative dose of several thousands of shots. They tell me that the more shots you have, the less it hurts. I don't know. I haven't embarked on that personally. There was a randomized crossover study of 26 people with relapsing-remitting or secondary progressive MS, and in that small study, this treatment yielded no beneficial effects on relapse rate, disability, fatigue, MRI activity, or quality of life scales, but obviously that in and of itself is a very small and perhaps underpowered and inadequate trial. There's always the rare risk of anaphylaxis, and in the literature there's warnings that stings around the eyes have anecdotally, you know, around the eye socket area have anecdotally been reported to provoke attacks of optic neuritis, so there are warnings not to give in that area. But many people swear by this, and so the practice continues. What about Chinese herbal medicine? Well, the safety of this is unknown for many of these, and I will have often Asian patients that bring in these lists of things they're taking that they are in Chinese, and I'll ask them to try to find out what's in there, and sometimes they, because of, you know, a different dialect or whatever, they're not even able to read the ingredients, and we've tried writing away to special herbal doctors in Toronto or New York to try to figure it out. But the safety is unknown for many of these components. They're often moderately expensive, and people will fly to certain centers, like I said, New York City, perhaps, or Toronto, where there are practitioners. And then there's potential concern about some of the components in these mixtures of medicines, that they might be activators of the immune system. So some of the drugs that are reported to have some role of activating immune function are Asian ginseng, astralagus, maitake, and reishi mushrooms. And so, you know, the question is, might they increase autoimmune activity and tissue destruction? Many people are taking antioxidants for various conditions, including MS and other neuroimmunologic diseases that involve inflammation. And the rationale is that a free radical-mediated oxidative injury. So there's free radicals or high-energy oxygen molecules that are floating around in the tissue, and that they may play a role in tissue damage for both axons and myelin in MS. And so that there are chemical agents that can be given to kind of neutralize these oxidative chemicals that are sometimes just generated by normal function. In EAE, the animal model of MS, there have been multiple trials of antioxidants that have shown benefit. And in MS, there are trials going on of inosine, alpha lipoic acid, and then various vitamin combinations. So this is an area that we need more information about. And other neurodegenerative diseases also have interest in the roles of antioxidants, including Parkinson's, Alzheimer's, ALS. There are many antioxidant compounds, however, that activate immune cells, including T cells and macrophages, and these could pose theoretical risks for MS or other autoimmune diseases. Right now, I would say that there are no trials of sufficient size, sufficient numbers of patients to have the power to show a benefit or lack of benefit in MS. Okay, here's something a little more mundane, but cranberry extracts are things that many of my patients take because there are multiple studies that show that cranberry can be used to help prevent urinary tract infections, not to treat an infection. Once the infection's in place, it won't treat it. It's not an antibiotic, but to help prevent. It's very cheap. There are potential risks, even for something that sounds as benign as this, in that cranberry may potentiate anticoagulant effects of warfarin. So if somebody's on a blood thinner, maybe they had a deep venous thrombosis in their legs, a blood clot, this may mess up their anticoagulation. And long-term use can predispose to kidney stones. Another agent that you'll see discussed is echinacea, and there are other immune-stimulating supplements. So people think, oh, well, this is immune disease, so I need something to strengthen my immune system. But really, the studies that we have of immune system activation by such supplements are generally limited to animal models or in vitro studies. And there are theoretic concerns, again, that this might activate T cells or macrophages and actually cause disease activity that's unwanted. Some of these medications also have other risks. Echinacea is known to increase hepatotoxicity of medications, or there have been reports of that. Although I was the other night reading in the literature that that's disputed, and others say that really that's not strongly documented. And this is a list of dietary supplements that have been, for various reasons, said to be potentially immune stimulating, and therefore it would be recommended to avoid some of these. And it's a long list. I put them up there. Echinacea is sort of heads the list. Asian ginseng, astralagus. I don't know. I'm not giving up my garlic, but melatonin, etc. Now, in terms of various herbal medicines, marijuana will come to mind, and marijuana contains chemicals that are in the class of cannabinoids, which do suppress excess neuronal activity. And you know, there's a whole controversy about the role of marijuana in various chronic pain syndromes, but also in other treatment of other symptoms for MS, and that would generalize to other the diseases that we're talking about today. There are some studies that show disease-modifying effects in EAE, and there may be multiple pathways with immune modulation and neuroprotective actions. There has been at least one rigorous study that showed subjective, you know, reported benefits, but no objective benefit on exam for spasticity and quality of life. And there's a 12-month study that showed a small benefit for spasticity. There are many potential adverse side effects, including sedation, nausea, impairment of function, including during driving, pulmonary problems for smoked marijuana, and also increased risk of head and neck and lung cancer, so not without risk. But this one won't go away. Dietary supplement, ginkgo biloba, is derived from the leaf of this tree, and it does produce anti-inflammatory and antioxidant effects. It is well tolerated, but may have some side effects. And also it does have weak anticoagulant effects, so there again, it might, if a person already had a tendency towards clotting problems, might be a difficulty. I didn't look up these articles myself. I think they're older, but there have been a few seizures reported with the use of this medication. It does not appear to be useful to treat MS attacks. There have been small clinical trials, but there have also been reports of improved cognition and fatigue. Okay. We've all heard about St. John's wort as used as a natural antidepressant, and indeed it has been used for that treatment effect for several millennia, but and probably helpful for mild to moderate depression, but not for severe depression or depression with suicidal ideation. Is well tolerated, can sometimes cause photosensitivity, like a tendency to develop rash in areas that are exposed to the sun, and fatigue. And it also induces enzymes in the liver that help to break down, metabolize other drugs. And so because of that, it can alter the level of many drugs that we all use in the treatment of MS symptoms, including, and other things, so including birth control pills, we wouldn't want to mess with that level. Anti-epileptic drugs, which are used for both seizures and pain, and warfarin, again, as an anticoagulant. What about diet? Well, so we've all heard about various diets for the treatment of, in particular, MS. You know, I keep, most of this literature is from MS since it's such a large population compared to transverse myelitis or NMO. There are polyunsaturated fatty acid enriched diets, and these include omega-3 and omega-6 fatty acids. And there's suggestive evidence that this may have disease-modifying effects if you have a diet that's low in saturated fats and high in these PUFAs. The evidence is epidemiologic, also in animal models, in vitro, some clinical trials. This kind of treatment approach is certainly inexpensive, well tolerated, and I would never advise against it because it's heart healthy as well. If somebody very strictly adheres to such diet and takes excessive PUFAs, that may cause vitamin E deficiency if it's not absorbed well. And also the omega-6 fatty acids have been reported to raise triglyceride levels. The Swank diet is an old and honored diet that was devised by Swank and Dugan and related to this, but it was reported to have therapeutic effects, but in truth has not been studied in a controlled, randomized fashion. One thing that is perhaps supported for use are the omega-3 fatty acids. There have been 3 trials in MS. One of these, a large randomized double-blinded control trial, did not find a significant treatment effect, but there was a trend, and you never know what to make of trends, for slower disability progression in the treatment group. There was another small report that trial reported for a trend of improved physical and emotional function in the omega-3 fatty acid treated group. So that's probably an area where we need more study. Low-dose naltrexone, I have a handful of people taking this in very low doses, and the claims are that it helps symptoms, prevents attacks, slows progression. It is a partial opiate antagonist and has excitotoxic and antioxidant actions. There's one very recent, just published in 2010 in the Annals of Neurology, 8-week study of 80 patients, and that's a very short window of time in MS, as you'll know, but it showed no effect on disability, but pain, reports of pain, and mental health quality of life measures were improved. However, in another study with only primary progressive MS patients, it worsened the pain. So this is an area that requires more study. Hyperbaric oxygen is a treatment that is, approved for treatment of certain infections and wounds, decompression sickness, and carbon monoxide poisoning. In 1980, there was a report of benefit in MS, and people have been trying to tout its benefits since that time, but subsequent studies have not really shown any consistent benefit. It's expensive and it's not recommended. And then there's a whole group, to me, perhaps the most interesting components of alternative medicine or complementary medicine. And these are the mind-body interventions that focus on the relationships between brain, mind, behavior, and their effects on disease and health. And certainly this is a burgeoning area of investigation and literature about such things as relaxation, decreasing stress, and studying the relationship of stress to the functioning of the immune system. In my own home institution, we have a whole unit that's been studying the effects of stress and immune function for, over a decade. And I know they started out with medical students, and they used to come in and they'd study various immune functions before and after an exam where they were all keyed up. And then they took couples, and they would study them before and after they induced a fight. They're always doing things to people in the research center. But at any rate, that's just one example of studies where they're trying to figure out how stress affects the immune system. Some of the areas of these mind-body interventions are meditation, yoga, biofeedback, hypnosis, tai chi, and visual imagery. For meditation, for several decades, we've had literature about meditation, the disciplined practice of meditation, causing brain changes, which can be measured in EEG and neuroimmunology studies. And there are studies that also show effects of meditation on endocrine, neurotransmitter, immune system measures. Tai Chi, there are small trials in MS that suggest therapeutic effects on walking, spasticity, and social emotional function. And certainly this is a recommended activity, but there are postures that involve moving moving the shoulders and limbs away from the center of balance, so there is a risk of falling. And many teachers can modify both yoga and Tai Chi for people with various disabilities. Yoga, there's one controlled trial that found that those who practice yoga experienced less fatigue, and this is certainly well tolerated and low cost. It can be modified. And there's even a book, there's several books, but on yoga for MS. So a lot of the review of the literature and sort of monitoring of all the areas of CAM has been done by Alan Bowling, and so I've put up a few references there. Really this just touches, is an overview, and there are many areas in which more detailed information and studies will be quite useful. I think especially including the effects of these mind-body interventions on immune function. So I'll stop there and ask if there are any questions.
I know it's anecdotal, but I have been using the deep trigger point therapy massage, and it has very definitely increased my mobility, and even is bringing some sensation back in a place or two. And I'd just like to say, everybody get on that wagon. I know it's individual to everybody.
Right, so that's a testimonial, one anecdotal report of benefit from basically one type of massage. And I think, you know, our patients know and seek out various forms of physical therapy and massage, therapeutic touch, because of their very definite benefits for spasticity and pain. Sir?
What does it take for a doctor to prescribe medical marijuana, and what are the differences in different states? And, you know,
So the question is, what does it take for a doctor to prescribe medical marijuana? And so I'm from Ohio, and that takes a lot. I think I'll be going to jail. But, so I really can't speak. It's state by state law, you know, and certainly there's some states that do allow that. And, you know, I've heard there are various clinics where people can go in and show documentation of their disease. So there is an agent called Marinol that is a cannabinoid, and I actually have prescribed that on a very limited basis, tending more to use it for people with appetite issues, because I just haven't wanted to have a whole practice of prescribing Marinol. But it is something that probably needs more study in MS. Okay. Thank you.